Hi, I'm Dr. David Hess, and I'm a primary care physician in West Virginia, and have been practicing medicine now for nearly 20 years, seeing tens of thousands of adults and children in my career. My patients sometimes ask me if the COVID vaccines are safe. My answer is yes. COVID vaccines are safe. They were first evaluated in tens of thousands of people who volunteered to participate in clinical trials. These clinical trials followed the same thorough safety and efficacy standards that the FDA sets for all vaccines in the United States. Since then, millions of people in the United States and around the world have received COVID-19 vaccines, and the results from the U.S. and global safety monitoring efforts are excellent. There are rigorous systems in place to quickly identify any safety concerns and take action. These monitoring systems provide information that allows public health and medical experts to update the recommendations and guidelines as needed to ensure COVID-19 vaccination is safe. When it comes down to it, COVID-19 vaccines are safe and effective. Vaccinations save lives. That's why I chose to be vaccinated and why I recommend COVID-19 vaccination to my patients and my family. Thanks for tuning in. I'm Dr. David Hess. For more information about COVID-19 vaccines or to find a location near you, visit vaccinate.wv.gov.
Get your COVID-19 vaccine, and you could win cash prizes, pickup trucks, and college scholarships. It's not too late to enter. Get a shot by Sunday, August 1st, and visit doitforbabydog.wv.gov.
Hi, I'm Dr. Catherine Moffat. I'm a physician specializing in pediatric infectious diseases at West Virginia University. My patients and their caregivers sometimes ask me if children and adolescents can have side effects from COVID-19 vaccination. There can be side effects, although not everyone has them. The side effects that children 12 and up can experience are similar to those in adults. These tend to be mild to moderate and include soreness, redness, and swelling around the injection site, tiredness, headache, chills, fever, or nausea. These effects usually last only a few days, and kids may experience some or none of them. These side effects can be a sign that the immune system is building up its natural defenses against COVID-19, but many people build protection without these signs. Similar to adults, these effects are more common after the second dose, yet that second dose is essential for maximum protection. Although these side effects can occur, they are short-lived and outweighed by the benefits of being protected through vaccination. Many cases of COVID-19 among children and teens are mild, but even mild cases in children can lead to long-term health problems. I've cared for children with COVID-19. Some of their cases can be quite severe. In fact, COVID-19 was among the 10 most common causes of death in children in 2020. And COVID-19 hospitalization rates among teens increased in the spring of 2021. COVID-19 vaccination is a safe and effective way to protect our kids against the virus. It protects not only the person who's vaccinated, but those around them as well, especially children who cannot yet get vaccinated. This is why I recommend that my patients ages 12 and older get vaccinated, and I encourage patients, parents, and caregivers to discuss COVID-19 vaccination with a healthcare provider. Thanks for tuning in. I'm Dr. Catherine Moffat. For more information about COVID-19 vaccines or to find a location near you, visit vaccinate.wv.gov.
Back to school is almost here. Has your family been vaccinated for COVID-19? West Virginians 12 and older can get vaccinated, and it's the best protection from COVID-19. Protect yourself and your family by getting vaccinated today.
Hello, everyone. It's Thursday, July the 29th. We've got a lot of news to tell you about today. We just had a extensive meeting with our coronavirus czar, Dr. Clay Marsh, and with our General Hoyer, who briefed me on a lot of additional information. We'll get it to you in just a second. They're joining us also today, but we'll get into that in just one second. Today we have 8 additional deaths that we have, that have occurred since last Tuesday. The 2,937th death is an 87-year-old male from Webster County. The 2,938th death is an 87-year-old female from Fayette County. The 2,939th death is a 54-year-old male from Logan County. Our 2,940th death is a 75-year-old male from Randolph County. Our 2,941st death is a 62-year-old male from Randolph County. Our 2,942nd death is a 66-year-old male from Kanawha County. Our 2,943rd death is a 92-year-old male from Marion County. And our 2,944th death in West Virginia is an 88-year-old male from Kanawha County. Over and over, I say the same thing to you. For these families, for all these people that have brought wisdom to West Virginia like nobody's business, absolutely, and to all their loved ones, please just think about them, keep them in your prayers, and I ask this so much that if you would just please, if you know these folks, pick up the phone, call, deliver a hot meal, do anything you can to express your regrets and everything and pass on your good feelings towards them and make them feel not alone. That is so important. Make them feel that these people are just not a number. Now, I'm going to go through this pretty quickly and then get right straight into the reason that these gentlemen are here today and the importance of what I've got to tell you. But our numbers for the state, we have 255 new positive cases in the last 24 hours. We have our daily positivity rate is at 4.35. Our cumulative positive is at 4.93. We have now 1,910 active cases that are in West Virginia. It's going up, and it's going up significantly. Our recovered cases are still over 160,000. We have I've just been told the newest update is we have 147 people that are hospitalized in West Virginia right now. I don't have an accurate number, I don't think, because this number is probably higher than this now. But of that, 54 people are in the ICU units. Look at our map. Our map is just filling up with colors that we don't want it to fill up with. Remember the map just a few days ago that was so green with, I think, 2 counties that weren't green. And now look. Now we've got a red county in Webster County. I was there yesterday. We have no orange counties, but we have 7 gold counties and 21 yellow counties. More than half of our state now, half of our counties are out of the green. It's not good. That's just not good. But let me get right into the purpose of these gentlemen coming today and where we are. Now, everybody's got to really pay close attention. We absolutely now in the state of West Virginia have 100 Delta cases, Delta variant cases. We all know that this came from India, and absolutely we all know that the infectious rate of this is 1,000-fold. Now, just imagine, you know, what Dr. Marsh will be reporting to you, or General Hoyer, or whomever, Dr. Amjad. They'll be reporting to you that this variant is different. It is much, much, much more contagious. And it is something that we absolutely are monitoring. We have done it and done it and done it. Now, I just told the General just this. We all hope and pray, because we're on day 503 right now. And we all hope and pray that really and truly what's going to happen with this Delta variant is it seems to surge to some level pretty quickly, and then it seems to drop off fairly quickly. We are so hopeful and prayerful that we are at a level that we could hope that we could be approaching a level of drop off, but we know better. We know better. And, you know, I termed it just a second ago with the General. In my heart, I believe, you know, I've got my gun up, I've got my safety off, and I've got my finger on the trigger, and I think I can see the enemy coming. And I really am hesitant to whether or not to shoot or not. But I know for sure that I can see the enemy coming. At least I think I can. You know, that's exactly how I feel. Because in my stomach, I believe and I feel that the enemy's coming. And the enemy is this Delta variant. Now, we all know that the exposure level of this Delta variant is much greater. We all know that Dr. Marsh, you know, will report to you today that you can walk through a mall, you know, and the air, you know, it's almost like going into a bar where people are smoking or something, and you can see it and you can smell it and everything. Well, you can't see and smell this, but it's almost like it just looms in the air in a much more infectious way. Now, so we got to do something, and we got to do something really fast. And West Virginia has always been on the forefront. You know, we're the third oldest population. We're the sickest population from the standpoint of all the different diseases that we have in our state. Today, we've got 147 people in West Virginia that are hospitalized. Everybody knows that this Delta variant is running through the land all across all kinds of other states. We do not want to be alarmist. We are not ready to move forward with mandating masks or anything like that. We absolutely will always be open to evaluating and being fluid in how we adjust and what we do. But right this second, I am directing our task force to evaluate all PPE levels all across our state. I'm directing our task force to look at all the hospital staffing and bed availability. I'm directing our task force to look at the nursing homes in the same way for staffing and preventative measures, and to see that we have a sufficient supply of antibodies on hand. Now, you know, basically, we are moving proactively, you know, from the standpoint of a foundational emergency planning program. Now, in addition to that, West Virginia, being the leader that it's been all along, we're in contact with the Pfizer folks, because here's what's happening. Across the land, we are now finding out, and that people that were vaccinated first, especially those that were 60 and above, me, you know, Kathy, all those that were vaccinated early on that are over 6 months out from their vaccination, we're finding that the antibodies that you have to fight off a Delta variant have diminished, and you may very well need to be looking at a booster shot. So we're going to do a trial. We're going to do basically a study in regard to that. And what we're going to do, we're going to call it the Booster Battlefield Assessment. And the battlefield part came from the general, because basically that's what we're doing. We're doing an assessment of the battlefield, and the battlefield is the Delta variant. Here's what we know. We know that from 2 months out from your vaccination, people begin to lose, you know, antibody resistance, and I'm not a doctor, so, you know, if I use the wrong terminology, just bear with me. 6 months out, we need to evaluate people like myself. We need to evaluate the folks that are in the nursing homes. And so we're going to do a voluntary battlefield assessment, battlefield assessment on a voluntary basis to gain data on antibodies and how protected you really are. And so in doing so, I am initiating that we're going to do that immediately. We're going to move on this immediately. And again, I am very, very hopeful that West Virginia will lead the way. I don't know of any other states that have done so, but in this situation, what West Virginia needs to do, you know, that our nursing home population that, you know, that is 60 and above, and you know, our folks that had a vaccination that are 6 months out from when they had the vaccination, that are 60 and above, we're going to ask you on a voluntary basis that we absolutely are able to draw blood, you know, check your antibody levels, and then, you know, compile data. And that data will be just this probably. It'll come out, you know, that if your antibody level has dropped below X, whatever X may be, you know, then it may very well be that through Pfizer and the CDC and all those out there that you are in need of a booster shot to be able to protect you. We all know that this Delta variant is here. We've got 100 cases now, and it probably will become more and more greater in the days ahead, and I have been advised by the top medical experts and the top people that I could possibly have. I have been advised and everything without any doubt that this thing in the next few weeks is probably going to get significantly worse. And if that be the case, we need the data. We need the data to know, you know, how we can move towards protecting our citizens in a better way. And that's why West Virginia has been on the forefront, and that's why we need to move, and we need to move right now. In addition to that, if you've not been vaccinated, we all know that as time goes forward and everything, the more people that are vaccinated, the better off we'll be throughout this entire state. You know, I made myself a whole lot of notes today, and I've probably left off a few things and everything, but I can tell you where we all started, where this all started in the very beginning. We had two real mandates in the very beginning, and they were really, really simple, and that was to protect our people and to protect the integrity of our hospitals, to make sure that our hospitals absolutely were equipped and staffed and everything to be able to stay strong for every case, for a heart attack or whatever the cases may be. But we had to protect our people and we had to protect our hospitals. In this situation right now, we need to move because, if we move and we move strong enough and we find out as we test people that their antibody levels are great, then what have we lost? We haven't lost anything. We haven't lost one bit of anything. But if we find out that their antibody levels have really diminished and they really are not protected against this Delta variant and we can give them those booster shots and everything, absolutely we'll save more and more lives. We've got to move. We've got to move right now to make sure, from the standpoint of our task force and everything, and to make absolutely certain that we are adequately supplied and we have the PPE. We absolutely need to make sure that our hospitals are staffed and we have an evaluation on the beds and how our hospitals are staffed, and we also need to check on our nursing homes as far as their staffing, their preventative measures, and to make sure that we have sufficient amounts of our antibodies, the antibody drugs. Now, this is not time, again, to be running through the streets in panic. It's not time for that. It's not time for that at all. We will now move our briefings back to where we will go, instead of 2 days a week, we will now go to Monday, Wednesday, and Friday. Now listen, anybody out there that would think, I wish to goodness we could be announcing we're going to be changing our briefings to 1 day or eliminating our briefings. We need to have the briefings. We need to be here right now. We need to be ahead of the curve. West Virginia has always been ahead of the curve. Absolutely, if you're one of those folks out there like myself that's had this vaccine in excess of 6 months, you probably should really strongly consider, and I would tell you, you really need to have your antibodies checked, and we'll be telling you how to do that, and it will be of no charge to you. We will cover every bit of that, and absolutely you need to have that done so that we can evaluate each and every person and we can come up to a level of what the CDC or Pfizer or whomever it may be would recommend from the standpoint of a booster shot. We need to protect our people, don't we? And so I'm going to go back and I'm going to go through and finish up the other announcements. Then I'll open it up to your questions and everything. And like I said, we've got Dr. Marsh on my right now. We've got General Hoyer on my left, and they'll be here. And I think, do we have anybody else? Do we have? Well, okay, you got all we got right here. Okay, that's good stuff. Okay, the reminder again about 65 and older. If you're 65 and older and you get any symptoms, gosh, you'll be crazy not to go get tested. Please go get tested. It is so important to go get tested. From the standpoint of the antibodies can really help you if we catch this early enough. Vaccine eligibility, 12 and older, second shot, get your second shot. Vaccine effectiveness, really good. Young people, we got to get you vaccinated. We're getting ready to go back to school. For crying out loud, you've got to get yourself vaccinated. That's just all there is to it. From the standpoint of the COVID information, it's all up there. I've talked to you about the Delta variant. Yesterday, we gave out a new truck to Michael Quinn in Webster County, and he's from Hacker Valley in Webster County. We gave a truck to a beautiful nurse, operating room nurse and everything, Ellen Taylor, and we gave $1 million to a lady, a beautiful lady, Wanda Coleman, who lives in Ronsford, West Virginia, which, I was just tickled to death. I mean, someone really close, to where Kathy and I grew up and whatever, and second home really is and everything. But Baby Dog was there with Wanda, and Kathy brought Baby Dog out and everything. I didn't see that picture yet. That's really good. Okay, I've got another thing. We gave away 2 scholarship winners, to any school in the state of West Virginia, and full ride on everything. We have one with us and one not with us. Keelan Howes, I think I'm pronouncing it correctly, but from Buchanan also won a 4-year scholarship, and he can't be with us today. But John Fox from Martinsburg in Berkeley County won a 4-year full scholarship and everything to any public institution in West Virginia. And John is with us, but before John comes on, I just say this. You know what is really odd? Now, this is odd. In the Eastern Panhandle is cleaning up on the scholarship winners and everything, but I don't think we've had a winner on the big trucks or the $1 million winner in the Eastern Panhandle yet. But it's really odd how all that works. But nevertheless, if John, you're on. If you've got the floor, sir.
Hey, good morning, sir.
Hey, John, how you doing?
I'm doing well, sir. How are you?
I'm great. Congratulations. Congratulations in every way.
Thank you. Thank you. I didn't even know until this morning when your office contacted me to join this Zoom call. Thank you so much.
No, listen, John, thank you for getting vaccinated. That's a big thing. I'm really proud of you and everything for getting vaccinated. Tell all your peers we got to have them all vaccinated and vaccinated soon. But listen, you just go on and do greatness with your life. That's the main thing in life. And really, when it really boils right down to it, you got a real opportunity now, 4-year full scholarship. Take advantage and go for the gusto in your life. Keep a real passion and you'll do great.
Yes, sir. Thank you.
All right. Thanks again, John. Proud of you, buddy.
Thank you, sir.
Okay, the last of our sweepstakes is now going to move one day because we're going to a Monday, Wednesday, and Friday briefing. We're going to do the last of our final drawings or lottery sweepstakes on August the 5th instead of the 4th on Thursday. And the registration is going to move from Monday, the cutoff on Monday, to Tuesday, and or from Sunday night to Monday night. Is that what you're telling me? Okay, it's going to move from Sunday night to Monday night. Okay, so anyway, get registered. That's the last of our sweepstakes winners and everything. Boy, we need you vaccinated really bad. We're at let me see. We're at 89.2% of our 65 years of age and older, and 82.2% of our 50 and older from the standpoint of one shot. We're at 67.9% of our total age eligibility, and that's really good, but we got to have more. We just got to have more. As far as all of our testing information, that's all up there. Our long-term care facilities, we have 5 long-term care facilities. That's jumped up some. We have 10 outbreaks in our church community in 9 counties. Braxton, Cabell, Fayette, Jackson, Jefferson, Marion, McDowell, Nicholas, and Putnam County. We absolutely have got to get our guard up. We have 1 inmate case and 1 staff case in West Virginia. Absolutely, we're good to go there. The great job. Remember about giving blood. Remember about the sales tax holiday that begins on July the 30th on Friday and will end at midnight on Monday, August the 2nd. Take advantage of that. It'll save you a few bucks. We have a new announcement. We have a new Veterans Secretary, Edward Ted Diaz. Edward, actually has spent the last 10 years of his life working with the U.S. Department of Veterans Affairs in Washington, D.C. He was born and raised in Huntington, West Virginia. We miss so much Dennis Davis. I cannot tell you enough what a great man and what a great job he did. And Dennis would be really proud, really, really proud, I'm sure, of this replacement. This selection is really good. He served 20 years in the United States Navy. I think Dennis and Ted Diaz were friends, and knew one another, and that's great too. You know, he has credentials that are off the chart. His first priority is going to be able to take care of the great vets of West Virginia, and second priority is to use his knowledge and experience on a federal level to be able to recruit more veterans to West Virginia. You know, he's a leading example growing up in Huntington and now coming back home to West Virginia. We just love it in every way. You know, he is an alum of Marshall University, and I love that. And his wife is Julia, and we just welcome him back. And again, we mourn losing Dennis Davis, but we're going to carry Dennis's torch and continue to run forward. And congratulations, Ted, and thank you so much for all your service, and I know you'll do a fabulous job. Here's something that's really, really good on one of the announcements. This, I guess this source called Business Facilities, and you know, they just came out and ranked West Virginia the first time ever for this publication. The first time ever they ranked West Virginia as 10th in the nation as the best, the best place to do your business. So West Virginia ranked 10th in the nation, best place as far as a business climate and best place to do your business. And it is a trusted magazine, you know, by the industry. And so big time congratulations to West Virginia. And they said the drivers primarily were Hyperloop on the way and all the great stuff that we're doing around the North Central Airport and everything, the renovations and the commitment from the state to really, really do work to amp up that area and everything, and all the great work that they're doing up there. So congratulations to all West Virginia, and congratulations and thanks to this wonderful magazine as well. That's all I've got. So nevertheless, I'll turn it over to our experts, and then we'll answer questions.
Great, thank you, Governor. Today we'll go first to Dr. Clay Marsh, our coronavirus czar.
Well, good morning, and it's always good to be here in person with the governor and with General Hoyer. The governor has given a lot of information to all of us today, and I want to talk a little bit about some of the emerging science and observations on the ground that really do support the governor's directives to us as the task force. We know that this Delta variant is very different. It's spreading throughout the world, and as opposed to what we'd seen in the past, that where different parts of the world had different forms of COVID-19, this is now becoming the single most common form of COVID-19 everywhere. In the United States, as we remember, on June 16th, it was 10% of the cases as we looked across the country, and today the Delta variant of COVID-19 makes up 93% of the cases. In early April, when we started to find the Delta variant in West Virginia for the first time, it was less than 1% of the cases, and today the Delta variant makes up 78% of the new cases and rising. And this is the variant, as you remember, that started in India. And the reason why this variant has been able to spread so efficiently, at least in part, is because it is in much higher concentrations in the airways of people who are infected. So this variant infects people. People that are infected by this variant can spread the virus much faster, maybe as quick as 24 hours after infection, certainly by 4 days that they can spread the virus efficiently. In the initial part of the pandemic, it took 6 days or more for people to spread the virus. And the important thing is the virus is present in over 1,000 times more concentration in the airways of people than the first virus. So as the governor said, there is emerging data that is coming out from Australia and from other places that people that walk through air that has been recently frequented by people who are infected with COVID-19, the Delta variant, like cigarette smoke, that air has enough concentration of virus that people have been infected that way. One person walking through a shopping mall infected 20 other people. And as we look at West Virginia, we see that of the cases that we have today, 100, remember last press brief it was 43, at least 3 of these are from church outbreaks. And as we look at that, 66% of the people infected in these outbreaks were not vaccinated, but 34% were fully vaccinated. And of that 34% fully vaccinated, 17% ended up in the hospital. So while vaccines are really important and work really well, and we've seen that in real-world data, the Delta variant can be present in such high concentrations that people can get sick and can transmit potentially the disease who are fully vaccinated, which is the reason why the CDC and others are starting to talk again about the potential benefit of masking for people who are at risk, both to keep you from spreading it and also keeping you from getting infected with this Delta variant. As we look at real-world data from Pfizer and also from the country of Israel, what the governor said is absolutely right. For the first 2 months, antibody levels, remember antibodies are the immune part of our blood system that is activated by these vaccines and basically binds up, covers the viruses so the viruses can't gain entry into our bodies. That after 2 months, we see a reduction in the amount of antibodies that are present, and after 6 months, we see a more significant reduction. And when we look at real-world data from Israel, what they found is that in people over 60 years old, greater than 6 months after receiving their 2 doses of the Pfizer vaccine, they on average only are able to be protected from being infected, again, with the COVID Delta variant, and developing some symptoms, not severe symptoms, not hospitalizations, not ICU admissions, not deaths, but some symptoms at about 16% protection. And that is concerning because we have also seen, as General Hoyer talked about last brief, that in our recent data, we have seen hospitalizations go up, ICU admissions go up, ventilator use go up, and we've seen that about 12% of people who have died in West Virginia have been fully vaccinated, and about 9.5% of people in the hospitals at the last press brief we did being fully vaccinated in West Virginia. So we are worried, as the governor has said, that particularly for people that are older, who are more vulnerable, including our nursing home population, our long-term care facilities, but also for people who are over 60 years old who've been vaccinated back at the beginning of the pandemic in December or January when we first saw the vaccines, that they may be seeing their immune protection start to go down. And so as we look at trying to lead, as the governor has always directed us, in this booster battlefield assessment program, we think that we can gather very valuable information that we can share with Centers for Disease Control, Food and Drug Administration, hopefully working hand in glove with the vaccine manufacturers, with Pfizer in this setting, to be able to demonstrate real-world data in the U.S. that we may be able to benefit our population and protect them from not only getting sick and dying, because the vaccines are still currently effective for even those people, but only from Israel at about an 88% to 91% level versus what we saw before, which was 96% or greater. So that's a lot of data, but the real concept here is we want to make sure that we're meeting the governor's initial demands and instructions for us, which is to save lives of people in West Virginia, protect the health of our citizens, and protect our hospitals' capacity and healthcare workers' capacity so that we not only save the lives of people who may get sick with this virus, but also to make sure that our hospitals don't get overwhelmed so that other illnesses like heart attacks and strokes don't take the lives of West Virginians because we're so overwhelmed at that level. The last thing I will say which I think is a really important end from this, for at least my comments now in the brief, is that around the country, not just in Mississippi or Louisiana or Florida or Arkansas, but all around the country, we're starting to see a surge of people that are going to the hospitals that are getting ill. In very large numbers, these people are not vaccinated, haven't had vaccines, and what we're seeing is younger and younger people going into hospitals today. In the state of Florida, they reported the average age of 50 years old. In Jacksonville, there was a report that people were in their 20s and 30s in hospital beds and in ICU beds in these hospitals. This Delta variant is different. It infects much more easily, much more efficiently, in much higher concentrations. Being outside is not completely protective. Being with people that are fully vaccinated is not completely protective. And because of that, we would really encourage all of our citizens, particularly those in the most vulnerable age categories or with illnesses or diseases, to be really, really careful, not only about potentially wearing masks again, but where you go and who you're around. When we look at the country of Israel that's been a leader, like we believe West Virginia in many ways has been a leader in the United States, they are now revaccinating people who are immunocompromised, who are taking medicines, say for rheumatoid arthritis or other illnesses, for people that have had transplants, for people getting chemotherapy. And they are now looking at whether or not they should give additional booster shots to people who are over 60 years old, who are over 6 months from their vaccination. And so are we, because like everybody else, like the White House, the CDC, the FDA, we want to contribute any information we can to not only improve the lives of our citizens first, but to improve the lives of citizens throughout our country and throughout our world. Thank you.
Thank you, Dr. Marsh. Next to Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good morning. I'd just like to reinforce a couple of points related to the urgency and the reason that the governor has done what he's done. You know, our task force on a regular basis looks at PPE. We talk to hospitals. We work with nursing homes. They are part of our task force. So when, and I put this in military terms, when the commander asks for an additional and a more regular battlefield assessment of certain things out there in front of us, we all need to understand that that's a result of him seeing information that maybe we generally in the public don't see, and that we need to understand they go back to his primary objectives of reducing the loss of life among West Virginians and maintaining the integrity of our hospital system. So we need to understand what we are doing, and what the governor has directed us to do is to give him as the commander a better focus on what's out in front of us and what we need to do to maintain the level of effort to achieve those two objectives that we need to get to. And as the governor's pointed out earlier, 89.2% of West Virginians over 65 have had at least one dose. 82.2% of people over age 50. And that has resulted in the direct reduction that we've seen in the loss of life and the integrity of our hospital system so far. But what we also know is that only 42.2% of the people aged 12 to 17 have had one dose, and only 47.5% of the people 18 to 29. And we know from what Dr. Marsh has told us that the age of impact is drastically reducing every day based on the changing variants. So what the governor is doing is surveilling the battlefield to make sure that we do the things that we need to do. And I had somebody ask me the other day, you're into this 500 plus days, what can an average West Virginian do to help all those people who've worked this for over 500 days? And my response was, help your friends, your neighbors, and everybody else get educated on the value of the vaccine, and even one dose is going to make an impact. We know that fully vaccinated people are still going to get sick, but we know that even one dose will have an impact. We've got to quit paying attention to for the false and misinformation that's out there, and we've got to get our fellow West Virginians vaccinated for the long term. But we still have a fight ahead of us. Thank you.
All right, thank you, sir. Dr. Inamjad and Secretary Bill Crouch had prior engagements today and will rejoin us next week. We'll now go to questions from members of the media.
1 second. Let me summarize one thing real quick, and I'm sure everybody got this, but we got a lot of viewers out there that are just watching from their homes and whatever, and I just want to make sure, that, I got a lot of information, that I've been getting over the last several days, but in the last hour, or a couple hours, I got a lot of additional information. I tried to make myself as many notes, but I want to make absolutely certain that everybody understands, exactly where I am and where we stand. There's no question in my mind that this Delta variant is absolutely something that we should be concerned about. Not panicked about, but concerned. And absolutely what we need to do, and that's why I've done 2 major things, and that is just this, is through the briefings, I told you the other day, I said, did you watch Dr. Marsh's face? Could you not see the concern on his face? And I brought it up. I brought it up in the briefing. I've seen General Hoyer get more animated and pumped up. And these guys are so smart and they're so good, so good. There's concern. Absolutely, there's not panic, but there's concern. And so that's why, and I want to make sure that everybody understands completely, that's why that I have directed the task force, 1, directed the task force to check all the PPE levels. We think we've got absolutely adequate supplies all over the place, but we want to make absolutely certain. Check the hospital staffing and bedding. Check the nursing home staffing and the preventative measures, and make sure that we have sufficient antibodies on hand. Basically do a foundational emergency planning program. That was one thing that I did. The second thing I did is absolutely immediately instructed our folks that we're going to move on this booster battlefield assessment. Now, let me just talk to you in words that Jim would talk to you like I do all the time. If you're 60 years of age and older, and you had one of the vaccines on the earliest dates, and meaning that your vaccine that you had the second dose, or your first dose of your vaccine rather, is now 6 months or older, or more older. So your first vaccine was 6 months ago or more. If that be the case and you're 60 years of age and older, we need to evaluate your antibodies. Now, with all that, here, because we can really, really help you. Just listen to what Dr. Marsh just said. It's being found out that after 6 months, your antibody level protection, I think he said was 16. He told me over there it was 19, but 16 to 19% of protection versus a 95. So if yours are that, we need to move, or at least get the CDC and Pfizer more information coming from this great state, leading the way like we have over and over and over, that you may very well need a booster to absolutely assure or to try to protect you the very best we possibly can. So this is going to be a voluntary trial. A voluntary trial of those folks in the nursing homes, a voluntary trial of all those folks that are 60 and older that are 6 months out on their vaccine. I'll get my antibodies checked today. Absolutely, I'll get my blood drawn and get my antibodies checked today. But those 2 things we have to move on, and we have to move on right now. And the other thing, with what we feel like, or what these great people have surely got me to feeling like it is without question we need to move our briefings back to Monday, Wednesday, and Friday. You know, and I hate like crazy we have to do that. And, you know, I don't want to alarm anybody, but we want to do everything we possibly can to save lives and to do everything to protect our people, and that's what we're going to do. So, you know, I go back to just this. I go back to Clay Marsh's look on his face. I go back to all the data that we have gotten over time on this Delta variant and how it's going through a lot of different places and everything. You know, yesterday I was giving out $1 million to a person in West Virginia, a wonderful lady, you know, right, not near, I mean, not far from my home. The call comes earlier in the day from Clay Marsh that he and Jim Hoyer want to meet with me and meet with me immediately. And I said, we'll do it first thing in the morning. You know, there was real need. Look on their face. Absolutely all the data. All my instincts and gut. Jim Hoyer's, General Hoyer's absolutely plead with us to get vaccinated. Now the call comes, we need to meet immediately. But all this says one thing to me. We got to move. We got to move. We got to do something, and we got to move. And we got to try to lead, absolutely lead the way. So that's what we're doing. Anyway, now you can go to questions, Jordan.
All right, thank you, Governor. We'll now go to questions from members of the media. The first today from Kenny Bass with WCHS and Fox 11.
Hi, thanks for taking my question. Congratulations on the numbers for those older West Virginians from 50 and older and 60 and older and 85 and older. But the problem remains that 49% of state residents are fully vaccinated, less than half. So that's been the problem for the past several weeks since we hit the wall. So look, battlefield assessments are great as far as moving forward, but how do you get that number up? You've given away millions and trucks and scholarships and exhorted people to do it, use science. Is it just something that's not going to happen, or is it going to take something that's a catastrophe in order for it to happen? Thank you.
Well, Kenny, you know, here's one thing. We can always look at a glass half empty rather than half full. The real number that we should focus on is we're right at 68% of the 12 and olders that have had one shot. Now, they got to get their second shot. And for the most part, we've had a pretty dadgum good success about people following up and getting their second shot. But Kenny, you are so right about one thing, and we continue to get a little better and a little better and a little better and a little more and a little more and a little more. But Kenny, the sad part about this whole thing is if this Delta variant comes and keeps coming faster and faster and faster, it'll be too late for a lot of people that didn't get vaccinated. You know, and the reality is, if in fact this thing gets terrible bad, will it take that? Really, will it take that for us to for us to awaken to the fact that we absolutely should all be vaccinated? I hope and pray it doesn't come to anything like that. But Kenny, all I can do, and all, you know, this great Dr. Marsh and this great General Hoyer, all we can do is keep trying to work. You know, General Hoyer, and he won't come right out and tell you this, but I'll tell on him and tell this. But he was right over in my office over at the mansion. We were sitting there in the library, and he looked at me and he said, you know, part of me says, you know, look, we've done everything we can do. We've done every single thing we can do, basically. And I'm not going to say it in the, there was more colorful words, but you know, we've basically done all we can do. So if the people that aren't vaccinated, it's their choice, and if they absolutely made that choice and everything, then let them suffer through the consequences. You know, that's all there is to it. And he said there's a big side of me that says that's what we ought to just come right out and say. Well, You know, Kenny, I don't want to alarm anybody, but Dr. Marsh is telling us now with this Delta variant that even people that are vaccinated can still transmit this disease, this Delta variant. You know, so Kenny, this is a time of some level of alarm, you know, from the standpoint that we are not saying that we're on a campaign now to try to continue to try to up the number of people that are going to get vaccinated. We're not doing that, Kenny, at all. What we're doing is we're doing an assessment of the supplies and resources and manpower that we have at our hospitals and PPE. That's because we're concerned about the Delta variant. That's one thing. And on the other thing, Kenny, you know, we're saying basically that we want to evaluate whether myself or others that are 60 and older, or the nursing home population 60 and older, that their basically immune systems have dropped from when they took the first shot to where they don't have the prevention to hold this thing off, and we need to give them a booster shot. We're way past the vaccine deal. You know, we still think that the more and more folks that we can get vaccinated in West Virginia, for God's sakes a living, absolutely it will, without any question, it will save a bunch of lives, and it could very well save theirs. But Kenny, we aren't here to do that today. We're today saying this Delta variant is right on our doorstep. It's already here in a lot of ways. It is 1,000 times more infectious, 1,000 times you know, more infectious from the amount of the virus that a person has. And absolutely, it's here. It's here. And it's here, and it can be tremendously dangerous. And if that, and even this, people are going to say, well, what about the mask mandate and everything? Well, just think about this. Dr. Marsh just got through telling us just this, that a mask, think about it. If you were to wear a mask, you know, with this 1,000 times more of the virus, you know, that is being spewed out of you when you're talking or whatever, 1,000 times more than the COVID virus, the COVID-19 thing we just went through. 1,000 times more. Well, if you wear a mask, you may be able to cut that down to 500 times. The masks aren't going to help us a whole heck of a lot right at the moment, the way we see it. So that's really not the issue today. The issue today is evaluating the supplies and the resources we have, and the issue today is, on the other hand, doing exactly what I just went through just a second ago. So you know, from the standpoint of whether or not we should have a booster shot for those folks that are older, and absolutely we need to evaluate that and be the first in the nation to be leading that trial forward. And the other thing is that we absolutely need to evaluate our supplies.
All right, thank you, Kenny. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, I was wondering if there was currently any consideration of ending nursing home visits or curtailing visits to nursing homes, and or any restrictions to elective surgeries. I know those were some of the first restrictions we put in place, you know, the first time around. I wonder if these, you know, those are the types of things that this assessment is dependent upon, or the next steps we might be considering. Thank you.
Charles, we're not there right now on anything like that. We just need to continue to evaluate and move forward. But you know, Charles, the main thing is just this. You know, let's just say where we are. Once we evaluate, we'll have a lot more data, will we not? We feel certain that we have all the supplies, the PPE and the staffing and all that. We feel certain we have that, but let's just make double sure. You know, that's my responsibility. And the second responsibility is this. We felt like that if you were 60 and older and you had both your shots, that you were good to go. Well, we want to make sure, don't we, And so that's why we want to do an antibody, you know, or basically your immune system. We want to do a study that is voluntary, that will absolutely give us information, because I am telling you what's going to happen. This is my prediction. Here's exactly what's going to happen. Those folks that are 6 months out, that are 60 years of age and older, I'm going to tell you that we're going to get in a situation where people are going to have booster shots. That's just all there is to it, to be able to protect them. And we want to be ahead of the curve.
All right, thank you, Charles. Next to Mark Curtis with Nexstar Media.
Good afternoon, Governor and Cabinet members. Governor, I don't want to be an alarmist either, but I look at some of these numbers, and the rise from 43 to 100 even Delta variants in just 2 days is a 125% increase. And then, if I'm accurate here, did I hear that 34% of people who have tested positive for the Delta variant, 34% were fully vaccinated? That sounds alarming. I don't want to be an alarmist, but where are we going with this? I mean, if masks aren't adequate to protect people, is another lockdown coming, or something to keep people away from people? It just seems like we're almost at a 5-alarm fire here.
Well, Mark, I mean, let's just be honest. I mean, there's no point in me even halfway being anything but dead honest with you. Mark, all of us are constantly trying to run a play without a playbook. Nobody knows the playbook, and nobody knows exactly where we're going to end up. But this is no time to run through the streets screaming. You know, it is a time to be very calm and very smart. And that's why we want to be ahead of it. You know, in this situation right here today, we do not want our 60-plus-year-olds to be unprotected, and here's a way we can evaluate them. And we absolutely don't want to be caught, you know, in a situation where we don't have adequate PPE or staffing or whatever it may be at our hospitals if we have a bad situation happen. And it is concerning. It is super concerning, because one other fact that just happened is just this is, and I made this note earlier, and let me go back to it, but of 88 cases of COVID that came in, the last 88 that came in, 60 of them were the Delta variant. So the variant is dominating now. The European strain or whatever is lesser. The variant is kind of jumping to the forefront. And if that be the case, we got to get ahead of it. Now, Dr. Marsh, add something to that, please.
Well, thank you, Governor, and thank you, Mark. And I think the Governor said it correctly. The good news, and the Governor talked about glass half empty, glass half full, and this is also data that comes to us from Israel, but it's also mirrored in the United Kingdom, that even though we see a reduction in the protection from these vaccines in people, and this is Pfizer specifically, in people that are over 60 years old who have been over 6 months since they got their vaccines, that is in the ability to be reinfected with the virus and to get some symptoms. So to get sick, to be like the flu, something like that. But when we talk about really severe disease, even with the Delta variant, or hospitalization, or ICU admission or death, these vaccines are still really good, even in those people, in protecting in that 88 to 93% range. So it's important for us to recognize, as the Governor has directed us, what we're trying to do is be on the sort of the leading edge, like the country of Israel has been for the world, and Great Britain, United Kingdom, to say that if we start to see people get reinfected more easily, and we see this protection from the vaccines perhaps starting to drop off after 2 months and then even more after 6 months, that may be the sort of the first stage of us seeing more people going into the hospital or getting sicker, where those vaccines may not be quite as effective, and particularly so in people that are older and sick sicker and may not be able to mount that sustained immune response like a young, healthy person would. So we're trying to gather that data, so not that we are reacting, but we're proactive, and we are trying to work then, of course, hand in glove with the CDC or the FDA or other agencies in our country, White House, to make sure that we are completely in line with everybody else, but that we are presenting that information in a way could be useful not just for us in West Virginia, but for our entire country.
All right, thank you, Mark. Next, we'll go to Mark Cram with WDVM.
Good day, Governor, Dr. Marsh, and General Hoyer. We appreciate your time, certainly. As you gather this data about the antibodies, will that be something that would be helpful to be posted to the website so that everyone could kind of see where the trend is going? And since we know that we should know what our blood pressure is and what our temperature is and our cholesterol level, what specific numbers, what is the criteria that you're looking for as that threshold of antibodies?
Mark, I appreciate you being on, and this one's got to go back to Clay. This is a little bit over my head, but Clay can, Dr. Marsh can handle this.
Thank you, Governor, and thank you, Mark. So what we are going to do is going to be to work with our reference laboratory, which is a laboratory that has served the state during the COVID pandemic, which is a laboratory that developed our own ability to do the PCR tests to measure the variants or to measure the COVID positivity, and also our sequencing laboratory where we're able to do the next generation sequencing to identify the variants like the Delta variant. And what we'll be looking for is both a threshold effect, and we will follow up with the exact numbers as we look at the population, but also we'll look for the ability to neutralize or to be very specifically able to impact the Delta variant as part of what we're looking at. So more details to follow, but the fact that the governor has directed us to immediately run to the fire in this way is one that I'm really proud of, and I think will not only serve West Virginia, but I think it has a really great opportunity to also serve our country.
All right, thank you, Mark. Next, we'll go to Paul Mullen with WCBC.
Good afternoon, Governor, Justice, Dr. Marsh, General Hoyer. The program you announced today seems like something that the Centers for Disease Control should have been doing all along. And now you're doing it on your own. Have you lost confidence in the CDC or at least their ability to deliver the information in a timely manner to where you would be able to act in time? Thank you.
Oh, Paul, that's a tough question. You know, Paul, if I were to say, have all of us lost a lot of confidence in Washington? Well, we have, and if we were really honest, we'd say, you know, West Virginia, we led the way in being bold enough to get out in front, did we not? And we need to continue to listen to all the experts, and whether they be on a national level, CDC, whatever it may be. You know, they have so many more resources than we have here, but just think, you know, Paul, there was a day when everybody was sitting around trying to figure out a system all across this country, a system on who's supposed to get the shots. The shots are finally here. Who's supposed to really get the shots? In West Virginia, we decided, no. We know who needs to get the shots. The people that are 65 and older, the people that are 85 and older, 80 and older, we need to get them now. We don't need the vaccine sitting on the shelf in the warehouse. We need to move, and we did, and we led the nation doing that. We did the same thing with our nursing homes, and whether we lead the nation with this or it doesn't end up that way, it doesn't really matter, does it, Paul? You know, at the end of the day, it seems tremendously logical to me to think, you know, that if this variant is multiple times more infectious and multiple times more deadly, first of all, you're nuts to not have the vaccine, you know. But on top of all that, Paul, if you're 60 and older and you've been fully vaccinated and you're just cruising around thinking all's good in the world, we need to make sure all's good in the world, don't we? Because we don't need to lose a bunch of the folks that went out, got themselves vaccinated and everything else. And the only way we can find out is do exactly what I'm talking about. You know, do the antibody test and do it on a voluntary basis and get as much data as we possibly can, as quickly as we possibly can, in order to be able to protect our people. So, Paul, you know, to answer your question directly, have we all lost faith in D.C. in lots of ways? Well, if you haven't lost faith, then you're absolutely living in a cave, because with what's going on up there and all the political wrangling and everything else under the sun, and it takes, you know, 3.5 months to decide, you know, whether you're going to have a bowel movement or not, you know, absolutely, we've all lost faith.
All right, thank you, Paul. Next to June Leffler with West Virginia Public Broadcasting.
Hello, good afternoon. So regarding this study that you want to conduct with those over 60, you mentioned that you're working with Pfizer and that we're seeing that Pfizer's efficacy is reduced after 6 months. Just tell me a little bit more about what we know about the Moderna vaccine and the Johnson & Johnson vaccine and how its efficacy changes over time.
Yeah.
Okay, thank you, June. Thank you, Governor. So the reason, June, why we are focused on Pfizer right now is because Pfizer has made a partnership with Israel, and the real world data that we are watching very, very closely is really coming from Israel and from Pfizer. Pfizer has also been the company that has been approved for 12 to 16-year-olds as far as vaccine, and Pfizer's already applied for emergency use authorization to consider booster doses that they've already applied to the FDA about. So they have in many ways been leading, but certainly that's not to diminish or take away at all from Moderna or Johnson & Johnson, the other two approved vaccines in the United States, because all those vaccines have worked amazingly to save many, many lives. And so we are deeply appreciative of all the vaccine manufacturers. But the data in Israel, which is really important, is that they found that there was still substantial protection, like I said, 88 to 93% protection from developing severe disease, hospitalization, death, ICU admission with the Delta variant. But they'd seen that there has been some reduction in that protection. Back, you know, a few months ago, it was 95%, not 88 to 91%. And a few months ago, the protection to keep people from getting reinfected was higher. And when you compare people in Israel who've had their vaccines in April versus people that have had their vaccines in January, and these are both with Pfizer, there is a substantial reduction in that protection against getting reinfected if you've been immunized in January. So at the governor's direction, what we hope to do is to gather real-world data in the United States, just like Israel has done as part of their partnership with Pfizer, and not necessarily, you know, independently act on anything, but use this information, share this information in a way where we hope that we can provide meaningful input to the leading organizations in our country, the CDC, the FDA, the White House, so that that can be part of that decision tree to be able to determine whether or not it is important and time to consider revaccinating some of these folks that have been vaccinated many months ago and who are over 60 years old and who are additionally vulnerable, as the governor said, because we know at the beginning of this pandemic, with a much less fit and powerful and dangerous form of COVID-19, the people that died in West Virginia and around the country, in our state, 77.5% of our deaths were in people over 70, and 97% of our deaths were in people over 50. And our vaccinations made a huge difference, and we want to make sure that we are really standing ready to reinforce that as needed to continue to protect our citizens in the best way. And if that shared data can help protect every citizen, then of course we are delighted to be able to contribute that.
All right, thank you, June. Next to Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everyone. If I understood, one of the new initiatives is the state is assessing the availability of personal protective equipment and hospital beds. But I think I also heard General Hoyer say those initiatives already exist. Is this a matter of increased emphasis? Katie Coyne of the Gazette-Mail in line behind me. I hope you'll give her question some consideration today. Thank you.
Do it one more time, Brad. We kind of lost part of it.
Governor, I'm asking about what is new about the assessment of hospital beds and personal protective equipment. Is it a matter of more communication and more emphasis? What is new that we haven't already been doing? Thank you.
General, I think you can answer this.
So, Brad, it's a matter of emphasis from the commander, which is exceptionally important, as well as frequency. So there are regular meetings with the task force with various organizations participating, but because the governor sees a storm on the horizon, he's directed us to increase the frequency with which we do those assessments to give us a better picture of what's going on.
So what?
All right, thank you, Brad. Next, we'll go to Brendan Tierney with WSAZ.
Hi, Brendan Tierney here with WSAZ News Channel 3. Governor, there are a number of federal agencies as well as other cities around the country that have announced they're going to require vaccinations for employees, and if they aren't fully vaccinated, they'll have to be tested either on a weekly or frequent basis and wear masks. Is that something you would consider mandating for state employees across West Virginia? And if not, what point do you think we might have to get there to see this vaccination number finally increase?
Brendan, we're not there now. But that doesn't mean that we won't get there. I hope and pray we do not get there. But Brendan, we absolutely are not there now. And I have said that very emphatically. You know, I absolutely want everyone to understand that as all the information keeps coming in, we want to continue to evaluate the information, and we'll adjust based on the information and based on trying to protect our people. Now, one last thing, and I want to say this to Brad. Brad was on just a second ago and asked the General. Brad, basically, here's what was proposed to me. You know, we know that this situation, and these two gentlemen that came immediately to see me today, they're very concerned. And they're very concerned about this situation, and therefore they brought it even more importantly to me than we already had. And we've been watching for weeks now. With all that being said, it was recommended to me, and I gladly said, absolutely, this is exactly what we should do. It is absolutely what all great militaries do. It is always what great businesses and everybody does. And that is just this. We continually assess, our PPE and our staffing and our beds and all that. We're continually doing that. But all of a sudden, when you see an enemy on the horizon, you absolutely go back and double check, do you not? And so that's what we're doing. We're just doing that.
All right, thank you, Brendan. Next to Katie Coyne with the Charleston Gazette-Mail.
Governor, thanks for taking this. It's been a while since we've had a question. I appreciate you saying you we're doing all that we can do and you've done all that we can do, in the same breath saying that we're not going to do mask mandates and other things to mitigate. I don't think anyone is against antibody testing and getting more information on the disease and the virus. In the meantime, between Tuesday and today, we're up, like they said, 125% with Delta variants. So are there any plans right now to put more mitigation strategies in place, up testing, do anything as crowded classrooms are set to get back and kids aren't vaccinated in 2 weeks? Thanks.
Okay, somebody, because it was kind of muffled and everything, you know, I was trying to understand. Did you get it, Clay?
I think she was talking about with schools coming up and with the variants growing, you know, about different mitigation measures that you mentioned. I think that was the question.
Okay, and her name was?
Katie.
Katie. Okay, Katie, this is the governor, and I hope, I'm really trying to answer your question, but Katie, as far as additional mitigation measures and everything, right now, we don't see any need to move towards additional mitigation measures at this moment. But Katie, that could very well change. From the standpoint of getting our kids vaccinated and everything before they go to school and everything, we would highly recommend that. And the more we get vaccinated, the better off we'll be. But Katie, what we're referring to here today is this primarily focused on the Delta variant and focused on the fact, you know, about doing basically a trial on you know, those folks that are 60 and older, as far as, you know, that had the vaccine 6 months ago, and how effective that vaccine is today to protect them against this Delta variant. And so from the standpoint of our booster battlefield assessment, you know, that doesn't really have anything to do with what you're talking about as far as additional mitigation measures and whatever. But we'll continue in every way to be very cautious and continue to evaluate and I don't know. You know, part of your question was, you know, we said, well, I don't know what else we could do. Well, you know, I really don't know what else we could do. You know, from the standpoint of we watch the data, we tell people over and over, you know, that they have to be vaccinated and everything. It is so important to be vaccinated. From the standpoint of mandating that, you know, all that would do is break us apart. And we have absolutely stood strong in West Virginia and produced great numbers by staying together. You know, from the standpoint, there's a lot of folks out there, and we want to be really respectful, really, really respectful. I don't think it's the right thing to not be vaccinated, but that doesn't mean that I don't think that I should be respectful to those that are out there and everything that decide whether they're not going to take the vaccine. You know, I think that is absolutely not the right choice, but I absolutely will always be respectful of their rights.
All right, thank you, Katie. Governor, back to you.
Well, I've talked a lot today, and I really, again, appreciate Dr. Marsh and General Hoyer coming and everything, and you know, I listened to them over in the mansion a good while, and then I said, you know, y'all going to excuse me just a second. I've got to go pee and then throw up, and because the information is not pleasing that's coming in, and it's not what you want to hear. It's tough stuff. It's just plain tough stuff, and it's worrisome, and we absolutely want to be, you know, on guard, and I want to be on guard for me too. You know, that's just all there is to it. And so we're going to be proactive. We're going to get out ahead of it like West Virginians have done and like we've done over and over. And at the end of the day, if what we do is test a bunch of people for their antibodies and they come back great, what in the world have we done except make them feel good? But if they don't come back great, and we absolutely can move toward the possibility of a booster shot that could save their life, what have we done but good? So at the end of the day, we want to be proactive and jump out ahead of everybody, and that's what we're doing. And from the standpoint of the assessment of the supplies and everything we got, we would be dumb bunnies if we didn't. We constantly do it, but on top of that, double, triple check that we're in good shape. because we know what we went through the first go round, and we had a lot of deficiencies, and we don't want to have any deficiencies if in fact this is something that is going to be bad. And all indications are we don't know how bad it's going to be, but it's bad. You know, if you'll just step back and look, 147 hospitalized right now, 100 cases, how that's jumped, and absolutely the dominance of those cases is the Delta variant over where it was before. The dominant of the cases was the COVID virus. You know, now it's the Delta variant. We got to deal with it. We got to deal with it. We got to do something. We're here to do two things. Protect our people and absolutely make sure that our hospitals are up and running and stay staffed and everything. We're going to do it. Congratulations, West Virginia, on being 10th in the nation. 10th in the nation in the business climate. That's really good. We got to beware. We're going to do it, West Virginia. You've been great. Thank you so much.
I'm Dr. Kara Willenberg, a physician and chief of infectious diseases at Marshall Health. You might be wondering,